Managing type 2 diabetes isn't just about lowering blood sugar. Poor control can lead to increased HbA1c level, cardiovascular events, heart failure, and kidney damage. Improving glycemic control and lowering HbA1c helps to reduce these serious risks and protect long-term health of type 2 diabetic patient.
Today, we'll explore the mechanism of action of SGLT2 inhibitors. First, let's look at the commonly used drugs in this class: empagliflozin, dapagliflozin, canagliflozin, and erdagliflozin. Although they have different names, they all work by blocking the SGLT2 protein in the kidneys to deliver important clinical benefits.
Let's understand important terminologies. Pause the video and read the important terminologies carefully.
Indications and dosage. All 4 drugs are indicated for type 2 diabetes. Empagliflozin and Dapagliflozin have the broadest indications covering type 2 diabetes, heart failure, chronic kidney disease. How does SGLT2 inhibitors work? Normally, kidneys filter blood and send glucose back to the blood, glyflozins. Like dapagliflozin, empagliflozin help to remove extra sugar through urine. Simple explanation: it flushes out the sugar that reduces blood glucose level.
Let's understand the mechanism of action.
This is the structure of nephron, a smallest function unit of kidney, which filter blood and reabsorb glucose into the blood. SGLT2, or sodium glucose cotransporter 2, is a protein primarily located in the kidneys. Its primary role is to reabsorb glucose from the filtered urine back into the bloodstream. In diabetic patient, this causes increase in blood glucose level.
SGLT2 inhibitor. It inhibits the SGLT2 protein, which is present in the proximal convoluted tubule of the nephron. This prevents reabsorption of glucose into the bloodstream. As a result, glucose is excreted in the urine through a process called glycosuria, which also contributes to lower blood glucose level.
Keep exploring the science behind medicine with pharmabiology. See you in the next video.